Welcome to another R6S podcast. Guys, today I have very special guests and we're going to talk about some shocking data, some things that a lot of our community doesn't know about. And gentlemen, Chelsea, thank you very much for making time for me today.
Thank you, Ash, for having us. We're really excited to shed light on this topic and raise awareness so that the community isn't shocked a year or 2 years down the road as we face some of this residual impact from COVID and just our healthcare system in general.
Absolutely. Dr. Kevin, if you don't mind, we'll start with you. What do you think is the issue right now, and what are you seeing right now in the community?
Big topic. I tell you, it's for me, it's been fascinating because I think there's been a lot of great work that's been done, but we've seen a lot of cracks in the system. And one of the biggest cracks that I think we've seen is that when all of this came down and we came to this stunning realization that we may have a lot of COVID patients to take care of, I think we all of a sudden realized how tight the margins are on hospitals. Mm-hmm. So we've had this move over the past decade, I would say, to more outpatient surgery, to ambulatory care, and the hospitals tend to be full with a lot of patients. They have to be full because that's how they make their money. And we didn't have a lot of room, and so we had to make room. Mm-hmm. And we're worried about all these patients. We have to be prepared. But then we forgot about something that's really important. All of the diseases that we normally take care of didn't go away. So now we're preparing for this potential invasion of COVID-19 patients. We don't have any testing. We don't know who has it. We don't know who doesn't have it. We have to protect our healthcare workers. But we also can't forget about all the patients who have the usual diseases, cholecystitis, they have appendicitis, they have cardiac problems, they have strokes, they have pneumonias. And that, I think, has been an extreme challenge in this whole event.
Absolutely. Dr. Andy, if you don't mind me asking you, it seems like hospitals got a lot of money. If I'm not mistaken, at some point, I think I saw $30 billion getting flown to hospitals. So where's all that money going, and how come it's not getting to you doctors like yourself?
Well, because we're not part of a hospital. I mean, and you know, for the hospitals, they really, I understand it. Their ERs had to gear up. I mean, when you look at what happened in Italy, I have friends who went and volunteered at some of the hospitals in New York and New Jersey. You know, we were all worried that we were going to get overwhelmed. So that money really did need to go to the hospitals in case we had that tidal wave of cases of COVID. But, you know, the hospitals spent that on getting these facilities ready. For a lot of the private practices in town, the independent practices, I'm a family practice doc. I'm not affiliated with the hospital, so we're basically sort of much more on our own, trying to scrap things around. And while I think it is important that we got those resources to the hospitals and they needed that, so much of the care that takes place in our communities, you know, the hospital is a small percentage of the care that takes place in our community. People are being seen by specialists. They're being seen by primary care docs. There's a lot of care that's taking place in nursing homes. And I think part of I don't think we've had a good coordinated approach to this. I think the hospitals have gotten good things, but in terms of how, you know, what urgent cares and primary care docs can do and what specialists can do to kind of battle this, I don't think we've had a good coordinated approach to that.
And what do you attribute that to? Is it lack of knowledge? Was the money not distributed properly? Is it bad policy? What do you attribute that to?
I think it's multifactorial. I think some of it is we just didn't know how this was going to impact different communities in different ways. And again, I think we were all sort of planning worst case scenario where, you know, no matter who you are, we're all going to be working in the hospital, you know, 24 hours a day, 7 days a week. So, and then I think some of it is just, you know, I have friends, I don't want to start getting into comparisons between different countries, but I have friends who are family physicians in Canada, Portugal, other countries. And when you have one of the advantages to having a solitary healthcare system is there's sort of a chain of command and communication within that. You know, in Reno here, we have 3 different hospital systems, 4 if you include the VA, multiple private practices. We have a health department. We have a county health department, a state health department. So it's really kind of it's a lot tougher to have sort of a coordinated approach that brings everybody together.
Gotcha. Makes sense. Chelsea, thank you very much for bringing up this to my attention, because I had no idea. I've always been one of those kids that grown up that your parents always say, if you want to make a lot of money, either become a lawyer or a doctor, right? So I thought all the doctors are right now are at least taken care of. Why do you think you had to bring this up to my attention, and also tie that into why you think our community should care about this?
Yeah, exactly. So I've been running around town the last few weeks, and our company works with medical practices across the country, all different types of specialists. And what I've seen across the plate is that all these offices have seen somewhere between a 65 to 72% drop in their production revenue. Yeah, it's huge numbers. And that's not if you're a general dentist or you're in plastic surgery, you basically came to almost a complete standstill. So we're seeing the impact of the last few months on these practices. And when I'm out in the community, and I'm very involved with nonprofits, I've heard nonprofits, I've heard individuals, if you need to raise money right now, ask the doctors. The doctors have money. And so it dawned on me that there's this misinformation that physicians and private practices make hand over fist. And the reality is that that's not true. They're fighting an uphill battle. Reimbursements drop every year. The hoops they have to jump through are going up every year. And it doesn't take a lot to disrupt that and put a practice, facing the choice of keeping their doors open or not. And that's why I thought, does the community know this? Do people not in healthcare, have they heard this? Are they aware that in a year or 2 years, if we don't really change some of the things, you may not have access to those private practices? So I wanted to reach out for a forum and invite practitioners and practice owners and give them a platform where they can raise this awareness and really share what the impact has been.
No,
so I'm very happy to have Dr. Halow and Dr. Pasternak.
Thank you guys. Thank you everybody for being on this call, because honestly, genuinely, I had no idea this was going on. I thought maybe some people are affected, and then over time I heard more and more and more people from, like, for example, one of my good friends from one of the hospitals, she's a nurse, and she was telling me about nurses being let go. It's like, wait, I thought we need nurses. How's that even possible? Now, who do you think, Chelsea, is being affected the most now, and what kind of industries are being affected, or what kind of doctors are being affected? Who is actually still operating and who's not operating?
Well, I probably could have Dr. Halow, speak to who's operating in the surgical side the best. Definitely from an infrastructure-wise, I think every specialty was hit. I can't think of any carve-out or practice that wasn't impacted. Anyone who does surgeries, basically, they came to a screeching halt. They wanted to protect the community. They wanted to follow the right directives for the CDC. Our primary care, our pediatric practices that still have tons of patients that need to be seen, all of a sudden had to scale way back to put new accommodations in place, or they were limited because they couldn't get supplies. Dr. Halow, do you mind jumping in on some of your thoughts of, was anybody in the healthcare in private practice not impacted, and specifically what happened with our surgical practices?
Well, I think everyone was impacted. There was no question. But I think the analogy that I would use would be this. Let's imagine that you had a huge corporation of trucks. Mm-hmm. And you had people to repair the trucks. You had all the trucks themselves. You had all the fuel. You had all of the executives that were paying for the trucks, but you didn't have any drivers. Mm-hmm. If you look at a hospital system, right, a hospital system is a huge corporation, and it has a C-suite, and it has direct reports, and it has nurses and healthcare workers. All these people are extremely important, but nothing can happen. Nothing can happen unless a doctor does something. Right. And so if you lose the doctors in private practice, it doesn't matter how many nurses you have, how many hospitals you have, how many administrators or operating rooms you have. No one's here to do anything. And I think for me, that was the most frustrating part of being in private practice. So when all this came down, instead of me being financially secure and saying, okay, I know where all the money's going to be. We're going to be fine. I need to get to the hospital and help take care of patients. I'm worried about keeping my private practice afloat.
Right.
I'm worried about trying to make sure that we can keep the doors open. And I think for me, that was the biggest letdown, is to have the state look at the physicians and saying, nah, it's really more important we keep the hospitals open. Really? And we can look at that, not just, and certainly in the surgical realm, we were still doing some emergencies, but almost everything was shut down. I have probably, just me alone, I have 50 patients that are waiting for surgery.
Wow.
And these are not unnecessary surgeries. Any surgery that I do is necessary. People talk about this concept of an elective surgery. There really is no such thing. If you either, there's really either an emergency surgery, you need it now, or you need surgery. But in any case, the other issue I think that's really important is this concept of primary care, of medicine, medical care. So the patients had no place to go.
Mm-hmm.
Primary care closed down. The ERs closed down. There was no place for anyone to go. So if you had lung disease or heart disease or diabetes or any of these other things, you couldn't be seen. They tried to set up telemedicine. Telemedicine really isn't there. It doesn't work. So I think this is one of the big cracks in the system that I think we really need to learn from. We need to understand that having private practice physicians is a good thing. It's a good thing because it gives patients a choice. But private practice physicians are the drivers of the trucks. They're the ones who are doing the work. Without us, you can't get anything done. So I think it is definitely a symbiotic relationship. But if you're going to have a piece's peanut butter cup, you have to have both chocolate and peanut butter.
So,
right?
Dr. Halow, I absolutely agree with you, and that's a very important topic for us to talk about. If you don't mind, I want to put you on the hot spot really quick. I want to ask you, who do you think is at fault here? Is it federal government? Is it state? Did we just try to put a blanket approach to everybody? Should we have done this county by county or hospital by hospital? Or who's to blame here?
I think, to be honest with you, I think the problem started when we stopped calling doctors and we started calling everyone a provider.
Okay.
We stopped realizing that to train a doctor takes 12 to 15 years.
Mm-hmm.
From the time I started college, the time I was done my fellowship was 16 years.
Mm-hmm.
And so while we have advanced practitioners, we have other people who can help us, they don't have the same education and training. So we forget that doctors are a necessity. And in Nevada, to be honest with you, I think the biggest problem, and certainly nationwide, is there's a doctor shortage. And some people will argue, well, maybe it's not a shortage, it's an allocation issue, but if you're in a rural area and you don't have enough doctors, it doesn't matter whether you call it allocation or shortage, it's still a shortage. So I would say probably it's on a national level. I think it's on a state level. I think we have to understand that, there's a base concept in business, and that's profit equals revenue minus expense. You cannot keep driving up expense, driving up requirements, and cutting reimbursement and expect that physicians are going to be able to stay in practice or even stay in, whether it's private practice or working for a multi-specialty group or hospital. They can't do it.
You talk about insurance, right?
What's that?
You talk about insurance reimbursement.
Absolutely. Yeah, we keep seeing every year that these Medicare says, well, if you don't follow these guidelines or if you don't meet these standards, we're going to cut your pay by 2%. You've already cut my pay by 10%. Medicaid, you cannot see patients with Medicaid and actually keep your doors open because it doesn't pay enough. And when you add on the electronic medical record, all these sorts of things, we talked about at the beginning of the podcast, this idea that hospitals were overstressed. They were on a tight margin. Physicians, as Chelsea said, are on a tight margin. They don't have 6 months in cash.
Right.
And so if you have a situation where you have this pandemic that you realize, oh my gosh, look what's happening, we need to make sure that our physicians are there for us, because without them we can't do anything, and they're already stretched to the max. You got a big problem. I think probably lesson learned from this, we really need to go back to the drawing board and say, how are we going to get more physicians? How are we going to get more physicians in Nevada? How are we going to get more specialties in Nevada? How are we going to support private practice? How are we going to do these things to make it easier for physicians to practice?
Absolutely.
Not more owners, less owners.
I would love to get to that. I want to kind of talk about solutions, but prior to us getting to that, if you don't mind, Dr. Andy, maybe you can explain what do you think are going to be the consequences of what we've done? Because obviously we made a lot of bold decisions. We didn't give a whole lot of time, and I mean, we are where we are now. So how do you see the next year, 2 years, 6 months, 5 years? How do you see that coming up?
I think it's impossible to figure out until there's so many unknowns in terms of, do we find a good treatment for this? I mean, if tomorrow we found some treatment where we had, a 98% success rate in terms of treating COVID, this whole equation changes. If a vaccine comes out that looks like it's safe and effective, and we can vaccinate, especially the older folks who are at a higher risk of dying of this, that's going to change. So I think it's really, really hard to figure out. We are starting to say, okay, we need to get back and we need to start ramping up. And when you ask that question of, is this a federal issue? Is this a state issue? We've done some survey data in the state. 97% of the docs in the state have seen a decrease in their productivity, which equals, because every physician in the state is basically, you're on a productivity basis. 97% of them are seeing a drop in their productivity, which means they're seeing a drop in income. But I'm also on some national surveys. I'm involved with some national family medicine surveys, and we're really seeing this all over the country, where providers are saying, I don't know if I'm going to be able to keep my doors open because our productivity's dropped, but my expenses have stayed the same. So, I think we are going to have to start getting back to normal. As Dr. Halow mentioned, we need to make sure that we're still treating patients with cancer. During this whole thing, I've had 3 new patients who have had out of control diabetes, and so we're trying to manage them by telehealth and by different ways. So we're going to have to try to find some balance there of, making sure that we're taking care of high blood pressure and doing screening tests and all the things that we should be doing while still, worrying about this COVID.
That scares the hell out of me, Doc, if I'm going to be honest with you, because my father got 2 bachelors, 2 masters, and a PhD from USC in the 60s and 70s, and then he started traveling the world after that. So he unfortunately had me in Middle East instead of having me in the United States or anywhere else in the world. So, and I was lucky enough to grow up in 7 different countries, living kind of going in and out with him. And one of the things, as soon as we came back to the United States of America, one of the things that always warmed my heart was our healthcare system, right? Just because I knew even a person back in high school that OD'd on some sort of drugs, and he had no money whatsoever. He still got life flighted, and he got the best care possible. And I remember vividly my father coming back from India at some point, and he was telling me that he had to literally walk over dead or very sick bodies on the side of the streets. So this begs the question, what is going to happen to our community if this is what's going on with our private practices? If the private practices might not even be able to keep their doors open if this stretches any longer, what is going to happen to our community members that are so sick and need the care?
It's going to be really tough because, the other thing that's going to complicate this is so many patients are losing their job. And that's what I'm actually personally worried about is, we have a healthcare system in our country. And again, I don't want to get too much in, but we have a healthcare system that's really, if you're under the age of 65, is sort of dependent on you having a job to get healthcare for the most part.
Absolutely.
And we're having a lot of patients getting laid off, getting furloughed. I saw some statistics that it might be up to 30% in Nevada. That means, all these people are going to be losing health insurance. So, again, there are some creatives, there are some programs in our communities in Northern Nevada. We have access to healthcare and some other programs like that. But the one silver lining I would say out of this is I have been really amazed for the lack of coordination within the grassroots of the physicians that I'm seeing in our community. So far, we've been able to come up with some really creative solutions to some of the problems we've seen so far. So we've kind of gotten through that first wave. we were worried, again, we were worried that we were going to be like New York. We got through that. We're now going to have a second wave of problems. But again, we got some really creative physicians, nurses, other healthcare people in our communities. And I'm hoping we'll try to figure out some solutions.
Well, I know I speak for majority of the community. So from the bottom of my heart, thank you for everything you guys are doing, because what you're doing today, it's going to matter to us a lot more in the near future. Now, if you don't mind, let's segue to that as well. Where do we go from here? How do we make sure our private practices stay afloat? Dr. Halow?
Well, I think there's probably two sides of it. I think one side would be the idea of how do we get more physicians into Nevada. And I think that probably breaks down into both an educational issue and then the other issue would be reimbursement, monetary relief. In terms of education, you probably are aware that UNR and UNLV split about 3 years ago.
Mm-hmm.
And Carson Surgical Group, that's my group, we are part of the medical student education program at UNR.
Mm-hmm.
So the way medical school works, if you don't know, is that the first 2 years are didactics. Those are all the basic sciences that you do. The second 2 years are your clinicals. You're still studying, but you're doing clinical rotation, doing surgery, medicine, pediatrics. And then you match for an internship and then a residency, and then maybe in a fellowship. And so you have to train further afterwards. So when UNR and UNLV split, UNLV went to Las Vegas, but they have the University Hospital.
Mm-hmm.
UNR doesn't.
Right.
That's a huge issue.
Mm-hmm.
And no one's talking about it. Because without a university hospital, at some point in time, UNR is not going to make it. They're not going to make it. They have to have a university hospital. So that's one. If you train physicians here, chances are they're going to stay here. Because if you're training in med school and then you have residency programs, we really don't have that many residency programs in Reno. And Reno's a growing city.
Mm-hmm.
All the residency programs are in Vegas. We need some residency programs here. That's one side of the equation. I think the other side is, how do we help physicians stay in practice? Now, one way we can get them here would be to encourage them to come by saying, look, we're going to help you pay off some of your debt. Most doctors who come out of medical school have $250,000 of debt after they come out of medical school. That's a house. Somebody's got to pay for that. And it takes about 4 to 5 years to get your practice up and running, so you don't have any money.
Right.
So I think that there should be some incentives from the state to say, look, we're going to help you, we're going to help you pay that off. Because in situations like this then, when you have a pandemic and we see a drop in production, surgeons like me are a little bit older, we're fine because I have loans of credit, I have cash. But the young surgeons, we just hired 3 young surgeons to come in. And they don't have anything yet. They're building their practices. They don't have any safety net. So the state, I think, should be providing or at least helping us with some type of safety net. I also think that there should be some coordination between businesses and the state to say, look, if you're going to if you're going to do business in Nevada, part of your responsibility is to ensure that you're providing health care coverage for your employees so that they can be seen and treated in Nevada. And again, it's interesting, when this pandemic occurred, no one talked about that.
Right.
They said, well, we're going to give you $1,200. But no one said, we're going to make sure your health care benefits don't go away. No one said that.
Right.
I think there's a lot of things. I think there's a lot of great things the state could do. We'll see what happens.
For those of you out there who are listening to this, here's what I want you to do. I want you to contact your local officials. I want you to contact your elected officials. I want you to tweet about this. I want you to share about this. This is something that I had no idea about. And guys, this is directly affecting us. Again, if I need my medical care, because to me, there are 3 professions that really matter to me, even as an entrepreneur. My lawyers, my CPAs, and my doctors. Because, 4 or 5 years ago, when they found those 3 lesions in my brain, and Dr. Halow, this is where I agree with you heavily for UNR, is that Cedars-Sinai could not figure out what those lesions were. They changed the diagnosis on me multiple times, from brain tumors to multiple sclerosis to RCVS and you name it, right? And when I actually got together with Dr. Molly Johnson, my Dr. Ray Chu was my main neurosurgeon in Cedars-Sinai, and then I got together with Molly Johnson at UCLA, and thank goodness for her, because she was able to give me a lot of clarity as well. Not that they can find anything at the end of the day. I still suffer from the same symptoms that I've had, a little bit lower, but thank goodness for UCLA, because they had those equipment, they had those luxuries for me to get there, at least get a second pair of, or get a second opinion, and it really truly helped. And I know a lot of good things come out of university hospitals as well. Now, I want to kind of bring this back also to the community. What can we do besides what I just mentioned? Yes, please, Chelsea, if you don't mind talking about that. What can we do as a community to make sure we're behind this? Because this directly affects us.
And I think that's the point. Medical practices knock on the doors of big insurance companies and hospitals and their policymakers all the time, and we don't get anywhere with them. And so patients have to realize that as health insurance has changed and you have more financial responsibility, the patients are now the third largest payer technically that exists in our country. That means you have what? You have buying power, and you have power and you have say in your care. And so invest your money into healthcare where it matters. Find private practices for your care and your treatment. When your insurance company sends out surveys about your experience with that provider, fill it out. That's how that provider gets more clout with your insurance company. Engage with your practice. Take the time to give them feedback about what you love and what works or where they can improve. I don't know any doctor that doesn't want to hear how their practice could improve or meet you halfway. So be engaged. And again, don't forget that you have that buying power in the market. Your insurance is going to listen to you eventually where you put your money. And so you're the voices that private practices need.
Absolutely. And in my tech career, when we were working on marketing and advertising, I had never heard of an industry called reinsurance. And when I was introduced to reinsurance, guys, for you, some of you out there who might not know what reinsurance companies are, they're insurance for big insurance companies, right? So imagine that. I was just stunned, and that's where it started clicking for me why some insurance companies are even almost bigger than our banks, and it just makes a lot of sense for me too. So thank you, everybody, for spending so much time with me. I really appreciate it. I want to give you guys the last closing thoughts. If you don't mind, just go one at a time and tell us exactly what's on your mind and how we can help, if you don't mind, with some last closing thoughts.
You know, I think that the takeaway from this all was living through the past few months really brought it to the front and center of how financially vulnerable the practices are. And it very much worries me as a consumer of healthcare for the future. And we can't survive another wave of this. If we have another big shutdown, you will lose a lot of these practices. So, you know, have that mindset that practices don't make hand over fist, speak up, pay attention to things that are on the ballots that impact healthcare providers, and ask your doctor, what do you feel about this one? How should I vote on it? Don't turn your head to what's happening. If you have had an impact from private practice and you love your doctor, get involved, reach out to any of us to see how you can move the needle forward so we can save these practices.
Yeah, I think that, you know, it's that concept of Maslow's hierarchy of needs, right? And
Absolutely.
we can even see that in the community in terms of these lockdowns. People need certain things. They need to be, they're social creatures. They need to feel, they need to be with each other. But what do they really need? They need food, they need water, and they need to be healthy. They need to be healthy. Without physicians, you don't have that. So you can do all the things you want to do. You can be out at your job. You can run for office. You can be a politician. You can be a lawyer. You can be anything you want to be. But if you're not healthy, you can't be that. We've seen that in this pandemic. And doctors are here in this community to help you. They are here to take care of you. They are here to keep you healthy. But if you don't have them here, you're not going to be able to do anything else. And I think somewhere along the line, we lost sight of that. We forgot how important doctors are. And the reality of it is at the end of the day, we have families too. We have to feed our families. We have to take care of our staff. We have to pay our staff. We have to pay our rent. And if we keep getting reimbursements drop, if our expenses keep going up, we won't be able to stay here. So that, I think, is really important for people to remember. You need your doctor. And if you need your doctor, then you're going to have to tell other people, say, look, stop. Let's support the doctors. Let's not keep beating them down. That's what I would say.
Couldn't agree with you more.
From my perspective, I mean, I'm really hoping within the physician community we start looking at our whole system. And I think, like everybody's been kind of saying, this is really revealing some of the cracks and flaws that we've had in our healthcare system, really probably over the last 15 or 20 years. And it's really just sort of shining a light on it. So I'm really hoping once we kind of get through this, things settle down, if we get this COVID under control, we really start to look at how we can make substantial changes in our healthcare system that go back to physicians really caring for patients and not having to fill out paperwork for insurance companies and a lot of the busy work that doesn't benefit patients, it doesn't benefit the physicians, it doesn't improve health, but it makes insurance companies happier. So like I said, I'm really hoping we get through some of that. On the upside, I mean, I would say this is forcing us to be a little bit more creative. Things like telehealth now, which has been something that we've been talking about doing in our office. This has kind of lit a fire under our butts, and we're doing a lot more of that. And, you can't do it for every patient, but I have to admit, for a lot of patients right now, they're like, this is great. So, again, moving forward, I'm really hoping that our insurance companies go, yeah, telehealth worked during this time. Let's keep that kind of stuff going. So hopefully we get some innovation out of this that improves healthcare as well.
Doc, just correct me really quick for a second. It seems like this is probably not going to be the last pandemic we're ever going to go through as human species, is it?
Well, it's probably not going to be the last one we ever go through as a species. I've been talking with a friend of mine who's one of the viral epidemiologists for the state. We'll probably see other smaller ones like this. I can't imagine we're going to have another one this big, but who knows? I mean, our world, we're much more mobile. People can get halfway around the world within a couple of flights. But I'm hoping that this sort of gets us back to monitoring a lot of that stuff and maybe trying to stomp the fires out before they get this big.
Sure thing. Dr. Halow?
I'm a surgeon, so I'm not an epidemiologist or infectious disease specialist. But what I do think is fascinating about all this, in addition to this concept of travel, we really have altered the human immune system. Mm-hmm. And if you look at every night if you watch the local news, look at all the drugs that have come out to treat things like psoriasis or Crohn's disease, irritable bowel syndrome. Those are all drugs that suppress your immune system. Multiple sclerosis, and then we have also the transplant patients. All these patients have their immune system suppressed in some way. It will be really fascinating, I think, over time to see what data starts coming out as to what impact this is making in the actual transmissibility of a virus. I mean, when you think about a virus, again, I'm not an infectious disease specialist, I'm just a surgeon. Viruses are kind of interesting because a virus doesn't want to kill you. If a virus kills you, it dies as well. It needs your cellular machinery to replicate itself. So really what a virus wants to do is get in and get out. This coronavirus has been fascinating because in the way it's been transmitted, the things that it's done, and I think it's going to be really interesting to see in the future how we look at that. We have no antiviral treatments. In the Spanish flu, a lot of people died of secondary complications, bacteremic issues, and when you think about how many people died because they didn't have an antibiotic. The richest person in 1937, the richest person could die of a bacterial pneumonia, whereas a homeless guy in 2020 won't die because they have an antibiotic. The richest person in 1937 could have paid for that. We need antiviral treatment because if we're going to mess with the human immune system, when you think about how we can fight this. So I think there's going to be a lot of data that's going to come out. I think it's going to be fascinating.
For sure. Thank you for that. Guys, here's what I would say. You might be young right now, but the truth is you're going to need healthcare. So if you are the type that is a little bit selfish, make sure you talk about this because this is important to you. Also, you probably have parents. You have older people that are around you. This is going to directly affect them. They're not going to have the health care. You're going to lose loved ones. Your loved ones are going to suffer tremendously. So this, to me, is probably one of the most important things that I've come across, and I cannot thank you guys enough, Chelsea, especially you, for bringing this up to my attention. I sincerely, from the bottom of my heart, I got to be grateful to you because I had no idea this is going on, and I can't imagine how important this is for all of us, especially somebody like me who already has health conditions, and I definitely need you guys. So I can't afford to not have you guys be around. Now, with all that said, what can I do for you guys, or what can our tribe do for you guys to show your gratitude for choosing to spend your valuable time with us?
I'm just happy to be on. It's really been fun. I really appreciate you getting the word out. This is great. It's great.
I'm just going to encourage everyone in your tribe, please wear masks when you're out. They may not be 100% helpful, but even if they help 15, 20%, every little bit's going to help. You know, we've done the social distancing. We're going to start opening things up. You know, like I said, there's some debate, but if you can wear a mask, that may help a little bit, and every little bit's going to help. Let
me take 2 seconds to talk about that. Yeah. I saw a video from Dr. Fauci saying that you don't need to wear a mask. Why would he say that?
How long ago was that video?
The video I saw, I don't know if it was a repost or not, but it seemed like it was still relevant to COVID-19, and it seems like I think the video was posted 2 days ago, but maybe it was a little bit older. I don't know.
So when this first came out, there was some debate about do people would need to wear a mask or not.
Okay.
Right now, the most current recommendations are saying, you know, we still want social distancing. Stay 6 feet apart. Wash your hands. The more you wash them, the better off. And then if you are going to be out and about, you know, wearing a cloth mask, the CDC has now come around on that. And I think Dr. Fauci's come around on that too. If you can wear a cloth mask, that way if you do get within that 6 foot radius, again, is it going to be 100% perfect? No, but it's better than nothing. So, you know, like I said, that recommendation's kind of changed quite a bit over the past couple of months. And like I said, I don't think it's going to be a panacea for everything, but most people are saying we should start doing that more and more. And part of it is it not only protects, there's a lot of debate about it, but really what we're trying to do is help. If you're an asymptomatic carrier, it might help to prevent you from spreading that disease to someone who is older, who has problems with their immune system, that might affect them more.
Duly noted, doctor, and I will definitely give you my word that from now on, every time you see me out and about, I'm going to be wearing a mask.
Ash, I would tell people who follow you and listen into this, it's not often that you get a look behind the curtain into healthcare, and so ask questions. If you are interested in learning more about this imbalance and struggle between how healthcare funds are distributed, or what gives a hospital more buying power, higher reimbursement than our private practices, start, reaching out. Post back to Ash and his company with questions, with things that you want to know. You're only as strong as the information that you get, and there is doctors like Dr. Halow and Dr. Pasternak across the country who would be more than happy to share insight and information so that you can educate yourself more about what truly happens and the struggle that private practices face.
Absolutely. Guys, if you need to get in touch with us, 775-372-2008 is our number. If you have any questions for either one of these doctors or Chelsea, I'm happy to put you guys all in touch. 775-372-2008. Thank you guys very much again for choosing to spend your valuable time with us today.
Thank you, Ash.
Thank you.
Thank you.
Bye.
Tribe, if you hear something from us that resonates with you, please share it with other people. Talk about it. Don't keep it just to yourself. Conversation creates more education. And also, always, always, always fact check everything you hear. So hopefully this creates more education for you, more conversation. Talk to each other, talk to your family, talk to your friends about it, and we will see you next time.